Check, check, check. Can you hear? Check, check, check.
Check, sound check. Can we get a little louder? Is that better? Okay. Check. Sound check. Right here. Yeah. Okay. Is that better? Check. Sound check. Get closer. Oh. Like, okay. All right. Spit on it. Okay. All right. Hello, everyone. Welcome. We are more than a little overwhelmed and very pleasantly delighted that so many people have come out to support us. We have all had each other over this last more than a year, and that's a lot. And Pittsburgh nurses, unionized Pittsburgh nurses, have had our backs the whole way. But now we're really seeing the community come out. We've had our elected officials behind us, and they're here again today. We just couldn't be more appreciative and excited that everyone's here today. My name is Jean Stone. I'm a nurse and I'm a member of Magee's maternal newborn resource team. I'm thrilled to be here today with my nurse and advanced practice practitioner colleagues at Magee. We are ready to join together to improve patient care and address the crisis facing the nursing profession. Nursing is a second career for me. I worked in IT for 16 years, but I decided I wanted to become a nurse because I love taking care of people and I wanted to do work that I know matters. And what we do at Magee absolutely matters. We deliver the majority of babies born in Allegheny County, and we provide best-in-class care for mothers and newborns. We care for critically ill patients of all ages. We provide cutting-edge care on our surgical and oncology units. We help mothers through high-risk pregnancies and care for some of the most vulnerable babies in the region. I'm really proud of the work we do. Proud of my nursing colleagues, our physicians, our support staff, our clinicians, and our managers, all of whom do everything they can to provide best possible care every day. I'm proud of Magee's commitment to excellence, and I'm excited to continue collaborating directly with our managers to improve care and achieve even higher standards in the hospital. I believe we all, whether we work at the steel tower or at the bedside, play an important role in making sure our patients receive the care they need. I also believe that decisions that impact our patients and our professions must be made with input from those of us that work directly with those patients. As Magee nurses, we expect to see difficult cases. We expect to problem solve and multitask and work hard every day. That's what we signed up for. But too many times we walk into our shift without the staff resources, or ancillary support we need to provide the level of care that we know our patients deserve. I see nurses and practitioners hustling to do everything they can with every minute of their shift, and I see families not receiving the kind of personalized education that we all want to give them before they leave with their newborn. Often we leave work thinking about what we did not get to do. And year after year, I see so many good nurses cycle through, leaving burnt out and overwhelmed. We have raised our concerns, filled out countless my-voice surveys, and we've spoken up in meetings and town halls. In fact, when we started organizing well over a year ago, administration told us directly that they heard us and that they would make changes and improvements. A year later, the root causes have gone unaddressed. We are told that additional staff, supplies, or overtime supplies are not in the budget. But we all see UPMC purchasing Super Bowl commercials, flying jets to Boca Raton, and paying $30 million to a retired CEO who hasn't worked in years. The truth is, and we should all stop and really think about this, we work for a health system that is an insurer and provider. And as nurses, we experience the conflict between those roles day to day. For too long, the insurance arm of our health system has prioritized expansion and competition at the cost of our care and our practice. And it's not just UPMC, it's everywhere. Other health systems like Highmark, Penn State Health, and Penn Medicine are also competing for covered lives. Yet in those health systems, union nurses and doctors are advocating effectively and making huge progress. Ultimately, however, our health system, UPMC, is the largest employer in the state, and they drive the standards across our profession. Because I love nursing, Magee, our whole team, our patients, and I want the hospital to be the best that it can be, I believe nurses and advanced practice practitioners must have a real seat at the table. Unfortunately, throughout our organizing, UPMC administration has worked to sow division amongst nurses and tried to stop us. They've discouraged talking and pushed department leaders to share anti-union information in huddles, town halls, and one-on-ones, including suggesting that we will lose what we have, not be able to work directly with our managers anymore, and that collective bargaining is futile. As we take this next step, we are calling on UPMC administration to work with us, not against us, to respect our decision, agree to a free and fair election with no delays, and refrain from any anti-union reference. We have united across our hospital, and we have filed for election to certify our union. We are ready to join with the thousands of other nurses and healthcare professionals that are working together to take back our profession and to improve the quality of care across our entire region. Thank you, everyone. Next, I'd like to invite my colleague, Paige Wingard, up to speak.
Hello, everyone. My name is Paige Wingard, and I'm a registered nurse in the intensive care unit here at Magee-Womens Hospital. Like many of my colleagues, I became a nurse because I wanted to make a difference, and I wanted to really take care of people. I've always felt it's important to connect with others, and this simple human connection is the biggest thing that we have in this life. That's a huge part of what we do in the nursing profession. And as every person here who has received healthcare knows, real quality care involves time, attention, and human connection.
Right.
And that's our calling as nurses. On units like mine that care for critically ill patients, it's vital that we take the time to connect with our patients and their families in order to help them through the worst days of their lives. That's a vital part of their recovery. Our job is to be present with patients in hard moments, take our time with them, to hold space for the grief, confusion, pain, and anger, and to create that space for recovery. Beyond all the science of medicine, the physical labor, all of which is very important, sometimes the one thing we have left to offer and the thing that can truly make a difference is the simple human connection that we all instinctively need. Here at Magee, we witness the entire circle of life. As nurses, we bear witness to the moment of a mother's incredulous joy as their baby takes their first breaths. And we bear witness to the moment of insurmountable grief when a family's loved one takes their last. It is dehumanizing and heartbreaking to have to rush through or cut ourselves off from those moments because we have simply too many responsibilities to attend to and too little support to do so.
That's right.
These moments are what we and our patients lose in the name of profit when insurance business is deemed the number one priority. Over the last year, we've been told repeatedly that due to challenging financial headwinds, we need to cut costs, and we feel that day in and day out. Even in the times when we finally feel we can breathe, when we have the staff to do our jobs competently and compassionately, nurses and units across the hospital are being downstaffed or sent home mid-shift to ensure that we're never overstaffed, even though we know we'll likely get more admissions later on in the shift and suddenly be drowning again. We have charge nurses like myself tasked with a plethora of responsibilities that we cannot reasonably accomplish to the best of our ability while simultaneously caring for our own patients. We have no hard rules ensuring our staffing ratios in the ICU are 1-2 or even if necessary 1-1, unlike ICUs at unionized hospitals like Allegheny General. That leaves us with minimal time to build that human connection with our patients. It's disheartening to rush through those interactions, and to be honest, it's on those days we're forced to question whether we're really still following our calling as nurses. It's those days that add up and lead to so many dedicated, experienced nurses and practitioners burning out, leaving the profession, wondering if it's even possible to make a difference at all. I've witnessed it myself, I've felt it, I've contemplated walking away entirely, but seeing the dedication and solidarity amongst not only my coworkers, but nurses and practitioners across the whole hospital has inspired me to want to help make Magee the best it can be. And uniting to form this union has given me hope that things really can change for the better. We don't expect forming a union to make everything perfect, but we know that our health system does have the resources to aim for optimal staffing levels, just like they do at Allegheny General Hospital. We know they do have the resources to build the kind of benefits and working conditions that would support retaining new nurses, not just cycling through them. So today, we're announcing we will reclaim our calling as nurses. We will bring human connection back into our work, and we will join with the thousands of other healthcare professionals striving to transform our profession to better serve our patients and our communities. I look forward to collaborating with UPMC and with our excellent management team at Magee to provide the highest quality of care to our patients and address the challenges that have driven so many nurses and practitioners away from the profession. And looking around me today, I can say there's no other group of nurses and practitioners that I'd rather do it with. Thank you, everyone.
Next, we have Darren Kelly from the Allegheny Fayette Council Labor Council. Central Labor.
Listen, my friends, I'll try not to be to go over what was already said, but as I was standing there, one of the things I caught is that not one time did you hear anything about a personal benefit. But I just heard over 200 examples of taking care of their patients. This union drive is more about all of you than it is about them. That right there, that selfless way that has made you the very best of your profession is what's going to make you win in this drive. You hear me? All of you. You know, let's be honest. It's been a couple years to get to this point. And I cannot be more frank with what I'm going to say right now to the executives at UPMC. We are calling for a free and fair election without any interference, which is the American right of everybody that's behind me. Do we understand each other? Now, I have heard about the first round of emails about the outside group. Let me say this, is that what they talk about and what can be provided. I'll tell you what can be provided. That's the solidarity of over 100,000 men and women of Allegheny County's labor movement. So I'll leave it at this. What has happened in the past can stay in the past. We recognize UPMC's rights, but I will tell you this. You can either see the light or you can feel the heat. One way or another, this election's happening. Brothers and sisters, we're very proud of you. We're at your back. Thank you so much.
We deeply appreciate the support of the union workers all over the county. Thanks, Darren. Next up is Anna Lee, Myra, and Jess from Allegheny General.
Good afternoon, everyone. My name is Myra Taylor, and I'm a critical care co-team nurse at Allegheny General Hospital.
My name is Anna Lee Yobi. I'm a lifelike nurse at Allegheny General Hospital.
And my name is Jessica Grayer. I'm in the lactation department at West Penn Hospital.
Good afternoon. We are here speaking for thousands of nurses across the Commonwealth when we say that we are so excited to see Magee nurses and advanced practitioners take this step forward. Many nurses at Allegheny General remember very well what it was like at Allegheny in 1999 when our nurses were organizing and being told that nurses do not belong in unions and that we could lose what we have and that talking about staffing ratios was pointless because they did not exist in any hospital in Pennsylvania. Our nurses went on to organize the first nurse union in Pittsburgh and to establish the first nurse-developed, legally enforceable staffing ratios in our state. And I can remember helping the West Penn nurses organize and how they were told that they would lose their flexibility and their direct relationship with management, and that the union would come into their hospital and make decisions for them. We as nurses knew that we are the union. We know that our united voice only strengthens our hospitals. And we are proud that by working together across our hospitals, we have improved by collaborating in our departments, improving care in our hospitals, and improving our nursing profession across our region.
During COVID, big health systems realized that nurses would just make things work, even if standards decline. And we started to see the same challenges everywhere. Experienced nurses left the profession. New nurses were asked to take on extra responsibilities. And so many good nurses felt stretched thin and burned out. 2 years ago at Allegheny General Hospital, we drew a line in the sand and announced that we needed to radically transform investments and working conditions in the nursing profession, starting with investing in experience and ushering a wave of new nurses in the door, starting at no less than $40 an hour. At that time, a lot of people said we were being unrealistic, and the health insurance company we work for, Highmark, said it wasn't in the budget. But at Allegheny General, we insisted on it, and we stood united because nurses, managers, and everyone else who cares for patients knew it was time to move the profession forward. We raised wages by an average of 23% and transformed staffing inside our hospital. It wasn't easy, but we demonstrated for them that if we were united, we could do things. And eventually, it turned out the budget was bigger than they thought.
And after that, West Penn nurses stepped up to negotiate their contract. They were inspired by what we had achieved. And we stood with them just like we are standing with you.
When we formed our union at West Penn, we worked with each other, reached out to the community, and resolved to set new higher standards for our profession and for our patients. That's how, in a first of its kind agreement for nurses and patients in our region, we established A1 staffing ratios in our union contract. We brought evidence-based staffing guidelines to hospital maternal child care in Pittsburgh. Now, Magee nurses and advanced practitioners are announcing they intend to join us at the negotiating table, and nurses all over the region, including myself, are inspired by their courage and advocacy for themselves and their patients.
I want you to all imagine what we can accomplish when nurses at both of our healthcare systems, that's UPMC and AHN, are standing united and advocating for patients together, rather than allowing big health systems to keep standards low. The nurses here and at all of our hospitals will take back our profession and transform our broken healthcare system.
And we want you all to know that we'll be with you every step of the way because we know that we are stronger together. And thank you all for your support.
Thank you, Myra. Thank you, Annalie. Thank you, Jess. I'd now like to invite my colleague, Melissa Dekas, to speak.
Hi, everyone. My name is Melissa Dekas, and I've worked as a nurse midwife for the past 8.5 years at Magee. Before that, I did my training here. Before that, I attended births here as a doula. And before that, I had 2 of my 3 children here under the care of wonderful nurses and midwives. I feel honored to get to do the work that I do, and I'm proud to work at Magee. The physicians, midwives, other APPs, and of course the bedside nurses that I get to work with are all second to none. I deeply trust my colleagues, and I know that they come to work every day wanting to provide the best possible care for the families of Pittsburgh and Western Pennsylvania. The nurses are the beating heart of this place, and I'm standing here because I believe that it's time that nurses and advanced practitioners have a real place at the table to make decisions about how we get to do our work. simple saying, midwifery takes time. It takes time to build trust in pregnancy, in the appointments where people can get all of their questions answered. It takes time to let the process of labor unfold and to support a first-time mom going through it. It takes time to walk with someone through a devastating loss and explain what they can expect and what options they have. Midwifery takes time. And if we're going to give our patients the time that they deserve, midwives need to be shaping the ins and outs of how we practice. It's time that nurses across Magee get a say in the practice standards we follow. It's time that nurses get a real say in safer staffing ratios. It's time that nurses have a say in our compensation, particularly to shape a transparent pay scale that compensates everyone well, especially our most experienced senior staff. That's why we want a real say in how care gets delivered, instead of having the corporate healthcare folks set the direction for where we're headed. Over the past 18 months, we've come together as nurses and APPs across a multitude of specialties and departments with a shared vision. And I'm so proud to see us coming together to win a seat at the table, shaping the way we get to care for our neighbors in Western PA. Thanks, everyone.
Thank you, Melissa. Next, I want to acknowledge how much support we have from our elected officials. And they are here in person, in force. We have staff in Congressman Chris Deluzio's office. We have staff for Senator John Fetterman. We have Mayor Ed Gainey. Senator Lindsey Williams. Chair of the PA House Health Committee, Dan Frankel. Representative Arian Abney. Representative Jessica Benham. Allegheny County at-large council member Bethany Hallam. Staff for Representative Lindsay Powell. And we received many messages of support from many more who couldn't be here today. Next, we are going to have our county executive share her thoughts with us, Sarah Innemar.
Well, good afternoon, everyone. Here we are again. But today is an incredible day for our healthcare, for our labor rights, and for our community. Thank you, Darren, for your leadership in the labor movement. Thank you to the elected officials who stand here today, and many more, I know, who will sign up and support this unionization effort. And thank you to the nurses and the advanced practice professionals who are sharing their stories. They're sharing the love they have for this profession and for their patients. And that love of their job should not be exploited. It should be respected. It should be invested. So I'm here to say, for the nurses and the APPs at Magee-Womens Hospital, I see you. Allegheny County sees you, and we have your back. These are the people who provide care to us, to our families, to our communities. They are seeing our most vulnerable community members. They're delivering babies. They're supporting new parents. And they're working with people often in the most fragile time of their life. And that takes time and care and attention. You nurses and APPs, you deserve to be heard, to be respected, and to be empowered in the decisions that shape the care that you deliver each and every day. And that's what this organizing effort is about. When nurses have a real voice in the workplace, patient outcomes improve, staffing improves, retention improves, and our healthcare system gets better for everyone. Yes. union is one of the most unselfish things that you can do, because it's about protecting, yes, your workplace and your paycheck, but the people who are going to come after you. It's about supporting the patients and making a better work environment and healthcare system for our entire community. And you heard from our other nurses from AGH and West Penn that this will happen. Care will improve. Workplace safety will improve when they get a union. This has happened across our region. The union nurses that have won contracts, they've delivered real, measurable improvements for patients and for the people providing that care. And let me be clear. So as Allegheny County Executive, I'm responsible for administering free and fair elections. So whether that election is at a ballot box or in a workplace, we demand a free and fair election. Obligation as the largest private employer, not only here, but throughout our Commonwealth, to rise to this moment and to ensure that this election can be free and it can be fair. Because a lot of our dollars, a lot of our taxpayer dollars actually go to support UPMC's work. And those resources should be going to patient care, not anti-union campaigns. Nurses, to the APPs, to everyone who's part of this campaign, I want you to know that I have your back, that you have an open line of communication to our office. If you are facing issues, if you are being silenced, if you need backup, I'm here. Please contact our office. And to the people who are in the community and who want to support this unionization effort, please make sure that you send a message that you stand with the workers who are fighting for their own dignity and fighting for a future for all of us. So let's support the people who care for us by making sure they have a seat at the table. Let's fight for quality care, strong contracts, and safe staffing. Let's get a free and fair election.
Thank you, County Executive. Last up, I'd like to ask my coworker Lucy in the NICU to speak.
All right, good afternoon, everybody. My name's Lucy Rose. I'm an advanced practice nurse practitioner in the NICU here at Magee. Magee means family. I married a man who was born at Magee, and in turn, I delivered both my sons here with two women standing right behind me. We give incredible care in our hospital, and I'm proud of our entire team for making Magee a special place. I stand here arm in arm, not only with my fellow nurses and advanced practitioners, but with my fellow mothers, my fellow Pittsburghers, because we deserve a healthcare system that was built for us. That's right. This is a city of neighbors, a city built on kindness and service to others. We pick each other up in times of need, and we deserve a healthcare system that does the same. We deserve a healthcare system that focuses on quality care, safe patient ratios, and not on Super Bowl commercials and private jets. We deserve a healthcare system staffed by dedicated nurses with real professional standards comparable to other fields. Parental leave, like the firefighters in our city have, so that when nurses whose job it is to take care of babies have their own babies, they have time to take care of themselves too. We deserve healthcare benefits that ensure none of us who work at UPMC providing care to this community are in debt to our own employer, just because we need to receive care sometimes too. the time with our patients to make sure that new parents go home knowing that little trick to a diaper change or how to get a nice tight swaddle. We need evidence-based, nationally recognized staffing guidelines that give us the ability to help all our patients thrive and not just survive. And we need a real voice in decisions that are made about our supplies, our resources, and our professional practice. Nurses and advanced practitioners are joining together for a seat at the table. We are joining together to ensure that the decisions made for the healthcare of our community aren't done by men high up in the steel tower, but by the people actually providing that care, the nurses. Let's go, Pittsburgh.
Thank you, Lucy. Thank you, everyone, for coming today. We love our hospital, our colleagues, our managers, and our patients. And together, I know we can do so much for our patients and so much for our profession. Thank you again, everyone.